Hi, everybody. Welcome. We are going to give just 2 minutes more so the people that is going to join us can connect. So let's wait just 2 minutes to give also respect for the people that is connect early. Okay, well, let's begin with this webinar. Thank you, everybody, to join us today. Today, it's going to be and well, this is I hope the sound is not overlapping, but well. So today we are going to talk about the skin longevity. This is a webinar sponsored by MD Ceuticals. So we are going to talk a little bit about how we can improve treatments of skin longevity with MD Ceuticals products. But first of all, we are going to focus on how we can complement it and create a full protocol on skin longevity. So let's begin with this webinar. Just to introduce myself, I'm Dr. Maria. I'm medic aesthetic doctor. I have a medical degree. I developed my medical degree in Mexico. And just give me 1 second. So sorry. Well, so well, that's just a short briefing of myself. I'm a aesthetic doctor. Right now, I'm developing the medical direction in the ceuticals and like the global strategy. And well, that's it. Just a short briefing. I love research. I'm in charm with all the researching, so that's my field. And here in MD Ceuticals, that's my daily work. So, well, let's begin with today's topic, just to know a little bit of what we are going to talk today. Today, yes, we are going to talk about skin longevity. Everything is going to be about how we can perform a full treatment of skin longevity. But also we need to introduce how we can make this difference between anti-aging and skin longevity, how we can make this full comprehension of the biology of the regeneration, and then how we can measure the age of the skin. It's important here to know that all these strategies that we are going to see are based in some papers. In the full presentation, you are going to find a letter R if anything is cited. So you are going to find this letter R, and at the end of the webinar, in 3 days, you are going to receive a full comprehensive ebook And in this ebook, you are going to find these R's, like references, so you can check it and you can see if you have any doubt, you can check it, or also you can ask with your distributor so we can answer all your questions. So let's begin with this. I hope you can enjoy it. And well, please, if you have any question, you can put it in the chat of the YouTube chat, and we are going to answer at the end of this webinar. So beginning with the first point, anti-aging and skin longevity. Anti-aging is a classic term of how we can correct a symptom of the aging process and how we can make look younger the skin. Since 2023, we are developing this changing approachment to regenerative treatment. In this regenerative treatment is where we can find the skin longevity. Now, so if we talk about correct the symptom of the skin, like could be add volume, like could be feeling a furrow, like could be relaxing a muscle, it's the anti-aging effect. So botulinum toxin, so fillers, so all the treatments that we improve one of these 3 points, it's considered anti-age. What is considered skin longevity? Skin longevity is mainly what we are going to do specifically with the cells, with the natural process of the cells. It could be energy, it could be regeneration, it could be skin quality, it could be nourishing. So in these points of the skin longevity, we are focused all the new treatments. Why? Because we see that in the old treatments, in the treatments of the anti-aging, we have a lot of change in the structure or in the natural way of the people see itself. So now we are going to these natural treatments. In the case of all these treatments of anti-aging, we don't want to say that they are going to be the old treatments. We want to say that we are going to measure all these treatments to correct more simple. Now, if we are going to do a botulinum toxin to make a lifting effect, we are going to do it smooth. We are going to do it really soft, so the person can see natural results without being an aggressive or a really radical change in the morphology of their face. So we can introduce the anti-aging treatments and the skin longevity treatments to make a full protocol, and that's what we are going to see today. So how we can differentiate between one patient that need an anti-aging treatment and a skin longevity treatment, because what is totally true is that all the patients are different. So sometimes we can offer an anti-aging treatment for a patient that is really conservative, or that patient that is really natural, and it's not going to be the ideal treatment for that patient. Then maybe the ideal treatment is going to be the one for a skin longevity, or maybe it's going to be one with a little bit of both, or both with skin longevity. No, so first of all, we need to focus and ask the question, what is going to do with this patient? If we are going to make a target to a specific condition, to a specific symptom, or we are going to make a global treatment. Okay, one time that we are over with this point, I want to see if I have a marker in here. Let me see. Well, no. Well, then after that, we need also to ask if the patient has this point of trying to do any correction to something that is previous to the aging process. I mean, if we are going to talk about morphology of the nose, if we are going to talk about natural morphology of the lips, it's an important point to use the anti-aging protocols. But if we are going to do something without make a change of morphology, we need to go by a treatment of skin longevity. So that's how we can start to develop a full protocol of these combined therapies between anti-aging and skin longevity. Then, what is going to be these longevity treatments, how we can perform a regenerative treatment in this? We need to make the difference between what is regeneration and what is not regeneration. Regeneration is going to be considered to everything that is going to modulate the extracellular matrix degradation. So if we are going to make any treatment to perform the skin quality, it's going to be considered regeneration. If we are going to add volume, if we are going to create more collagen, if we are going to make a a total treatment of rejuvenation, if we are going to make different treatments that they are going to change the morphology, that it's not regeneration. It's easy to know it like this. But the difference could create some concerns when we talk about the production of collagen. But collagen sometimes is not just about the natural collagen that we produce and the induced collagen production. So in this process of regeneration and what is not regeneration, we need to know that when we induce this collagen regeneration that is more than the natural way, this is not regeneration, and the one that is with the natural exercise to stimulate the fibroblast, this is going to be regeneration. So skin longevity is going to be focused on regeneration and in all these treatments in this area. So how we can start to introduce the patient, or how we can start to let know the patient how we are going to treat with that longevity treatment. First of all, we need to let know the patient what is the fibroblasts and how the fibroblasts work. So as you all already know, the fibroblast is the main cell that is going to produce collagen. When these cells starts to get old, when the cells get aged, these cells starts to produce less collagen, more dysregulate collagen. The mechanism of action and stimulation of these cells is going to be poor. No, so we need to explain to the patient this process, because this process is the one that is going to open to now start to explain to the patient what's going to be a longevity treatment. Why it's important to also explain this? Because with the longevity treatments, we work with the mitochondria. And it's not like these treatments, the non-regenerative treatments or the anti-aging treatments, is not the same as we can see a change. In the non-regenerative treatments or the anti-aging treatments, you can see a dramatic or a drastic change immediately. In the case of the longevity, we need more treatments. So we need to explain to the patient that the fibroblast needs times to recover, needs time to produce energy in the mitochondria, needs time for the telomeres to recover. So we need to be very clear in how we can see the difference between one structure of the fibroblast and the new structure of the fibroblast. And another point important to let know the patient and how to make a good introduction to the longevity treatments is to explain the hallmarks of the aging in the skin. So maybe this is one of the main slides of this presentation. So it's important here to focus on these 6 pillars of the hallmarks of the aging in the skin. So we need to make an approachment of this full cycle of the nutrition, of the physical activity, of the stress regulation, of the sleep, of the external factors and the social connection, because these 6 factors in the evidence is recorded like the 6 factors that can make an impact in these other 6 pillars of the aging process. Now, in the skin, we are going to have all these dysfunction process that create the aging process and that make that the longevity could decrease with the time. So we have all these precursors that could impact in the cellular senescence. We have all the mitochondrial dysfunctions getting by the time, the inflammation creating for all these external factors, the epigenetic alteration created also for those all these external factors and stressor factors, the matrix depletion, and the loss of proteosis. So all these 6 pillars can have an impact in these 6 lifestyle pillars. In the mainly that we can act directly, and we are going to be sure that we can create an impact in the office, in the clinic, is going to be the stress regulation. We can impact directly in the stress regulation of the cells, and in this way, we can make an impact in different ways in the lifestyle of the patient. So what the science says is that we need to impact in the nutrition, in the physical activity, in the sleep, and in the avoid of some external factors. If we impact in these 4 pillars, in the home care, or we introduce with the patient that they need to make change in these 4 pillars, we are going to be sure that the treatment of longevity is going to be a sure and an effective treatment. If you don't have an effect in these other 4 pillars and you just make an approachment in the clinic in the stress regulation, you are not going to have an impact in the other 6 pillars. So we are going to go really deep in this point, but it is important here to be clear with this. So as you already know, the chronological age and the biological age is totally different depending on the natural treatments, on the natural processes. I'm sorry, I need to check something because I think. Wait. Okay, no. Everything is okay. Well, so as you know, in the chronological age and the biological age, we have the difference between impacts in the natural way of aging process of the life and the biological change that we can introduce with all these exosomes and with all the external factors that can be induced in this aging process. So it's important here to make a screening of the patient, make a screening of how we can affect some exosomes, how we can reduce some exosomes to make a different treatment and to make an effective treatment. So first of all, we need to make an identification of the clocks or the skin clocks of the patient. We have 3 ways, or maybe 4, to identify. The easiest way is going to be in the clinic, identify the wrinkles, identify the hyperpigmentations. Maybe we can use devices like Visha. We can use visual devices that can help us to make a full screen of the patient and how we can focus or how we can predict the chronological age. But we have other protocols that we can perform in the patient to identify how is this skin clock, like could be the methylation of the DNA. In this screening, we can make a screening by blood, identifying how it's getting the methylation of the DNA in our patient. This is one of the main corresponding introduction to know the age of the patient. as you know, the DNA, when it gets started, this methylation process, and we can have this change of the methylation and in the DNA, we start to see a degradation of the replication of of the of the DNA, no, of all these proteins, and at the end, this impacts in the biological age by the end. So normally, when we identify these methylation groups, we can see more or less between 2 to 4 years of identification of the chronological age. And also we can compare with the biological age that we have with this methylation. This tool let us know how we can impact in the patient, and we can identify in the beginning and at the end of the treatment how we can make this full process of identify if our treatment is going right. Because we can work making a full treatment or making a full diagnosis of our patient, and how we can identify this age of the patient. But if you don't know if a treatment is the right treatment, if you are responding with the treatment, you will never know if you need to change one of your approaches. So this is a really good tool. Maybe it's one of the expensives. It's maybe not available in all the countries, but this is maybe one of the ideal ways. The other one is to identify the sugar's memory in the collagen. So we have the ages reader, so that this can let us know if the collagen is still applicated to the glucose. And in this point, we can know if we are having a specific biological age. This is a predictor of 14 years, the collagen and the fix of the glucose to the collagen. It can be a predictor of 14 years of the accumulation of this glucose. And by this glycation, we can know how old is the age of the biology of the skin. So this is a connector that is directly connected also with the lifestyle of the patient. It's another technique or another technology to know the age of the patient, and you can identify it by a laboratory given directly, so they can identify it, and you can do the same. You can identify it in the main consult, and then after 12 weeks you can also make this analysis. And obviously we have all the classics that we can have in the consult, that we can have in the clinic, like the cutometry, the craniometry. We can also read the transepidermal water loss. We can make an autofluorescence to make an identification of this aging process. But what I want to let you know here, and what I want to be clear here, is that you need to not just identify with the photos. Photos are magnific with to identify how the patient perceives itself. But in the longevity of the skin, it's not an enough tool, because the patient is going to be anxious in this process to know what's happening in the skin, how it's going with the skin, because the skin longevity treatments, they take more time. So the best tools to know it is going to be one of these three, like could be the age in the skin, like could be the methylation, or like could be one measurement toolkit in the clinic. Which is going to be the one to select? It's going to depend of your availability. If you have something that can make a prediction of the epigenetic clocks, if you have the accessibility to autofluorescence, if you have any scale to make a focus or measurement of the biological age, it's going to be the ideal. Just remember, the point is to do it in the first treatment, in the first consultation, and then make a evaluation after 3 months, after 12 weeks. Doesn't matter the treatment that you are developing, doesn't matter if you are making a combination. The ideal way to know if your treatment is working is making a measure. So try to do one of these introductions of these other techniques. So one thing that we talk about, how we can identify the age and how we can make this performance so the patient can know that we are working with skin longevity. Now we can go to understand how we can make a treatment. No, so we talk about how we can make a different synthesis and a different degradation with time, how we can get old with the collagen production, how we lost the hyaluronic acid with the time, how we lost the activity of the fibroblasts, and how all this affect by different external factors. No, so we can now understand how we can choose the ideal ingredient and how we can get focused on these different stress factors to make an approachment all of the skin quality. So first of all, let's talk about our main ingredient. Maybe it's one of the most popular right now, and is the polynucleotides. We have two different types of polynucleotides. We have the long chain of polynucleotides, popularly known like polynucleotide acids, and we have the short chain of polynucleotides, name it like PDRN. No, both of these chains are going to work in the same pathway, the A2A receptors. This line of activity is going to help us to make an angiogenesis, is going to help us to produce the vascular endothelial growth factor, and at the end, it's going to increase the nourishing in the tissue. So, as we know that the polynucleotides increase the nourishing in the tissue, when we have a sad skin, a dirty skin, and a skin that needs to increase this oxygenation, it is going to be the gold standard to make an approachment with these patients. No, the PDRN doesn't matter which one is going to be the technology for the patient. What's going to be the difference between them with the polynucleotides and the PDRN? If we use polynucleotides in an young patient, it's going to be the ideal treatment because these young patients doesn't need to fix thoroughly the DNA in the cells. These patients need to increase the angiogenesis, need to increase a little bit the collagen, and needs to regulate the inflammation. So the polynucleotides is going to be for these younger patients. By other side, the PDRN, it's a more aggressive or a more inductor of the A2A receptor. So in these cases, for the patients, the older patients, plus than 30, 35, 34, those patients that need to increase more the angiogenesis, the one that has more damage in the DNA, that we need to fix it, that we need to increase the collagen production, but also we need that these proteins are well adapted or well designed. We need to increase the use of PDRN. No, also we need to know that the PDRN also increase in a softly way the volume or the structure in the skin laxity of the face. So when we induce a treatment with the PDRN, it's not going to be just this angiogenesis. It's also a restructuration or a rebuilding of the tissue that is going to help us to make a reposition of the laxity of the skin. It's not collagen biostimulator because it doesn't work like this, but it's going to help us to that collagen that we want to induce could be more effective. What we see also with both of these treatments is that you can also have a regulation of the inflammation. But it's important here to know that all the patients that has rosacea or acne, as we have an increase of the angiogenesis, maybe it's not going to be the ideal treatment or not the PDRN. Polynucleotides can be an option, but PDRN is not going to be for those patients that they have an pathology with a radical problem of collagen production or a radical problem with inflammation production. So just to make that difference between both ingredients. Then we have another of these main ingredients, and it's all the coenzymes that we have, FAD and NAD. These coenzymes are one of the coenzymes that works directly with their sirtuins. Sirtuins work basically based in NAD to make a fix of the DNA change. So if we talk about longevity, if we talk about the treatment of recovery and regeneration, we need to talk about the sirtuins. The sirtuins decrease also the activity and also the capability of repair the tissue. And this at the end is going to create a cellular dysfunction and a cellular degradation of all the reparation of all the natural functions that we have. So when we induce any activation of the coenzymes, like could be with the NCT-HIAL, like could be with any, like with, for example, with the brand of the ceuticals, with the succinic acid, that they are going to induce the activity of the sirtuins, we are going to increase this reparation of the tissue. In the case of the NAD, we need to know that the treatments that we perform for a specific treatment of anti-aging, going back with the anti-aging treatments, if we put a treatment just with an anti-aging to make filler, to make a restructure of the tissue, we are not going to have enough treatment or enough energy to make that skin looks better. That's the moment when we see the skins get dull, or when the skin's it has a less activity, or when we see an excessive volume, but the skin quality is badly. So the treatment is not enough welcome. So in these patients that we need to restore the activity of these enzymes, of these sirtuins, to make an effective reparation, we need to induce formulations with NAD, with FAD, with succinic acid that can let us repair totally these treatments. As you can see, with the time, the NAD and FAD, they get decreased and they lose in more than a 50% in between the 30 years to the 70 years. No, it's not just about the collagen. In an older time, we talk about when you have 30, when you get to the 30 years, you start to lose the collagen. Well, it's not just about the collagen. It's also about the NAD and all the sirtuins activity that we lose with time. So we need to introduce this kind of ingredients in our treatments. Another popular treatment or another popular ingredient is the exosomes and the plant-derived exosomes. So in the case of the plant exosomes, the messenger, this is going to be the messenger that activate directly the activity of our cells. So we have the energy of the sirtuins, then we have the energy of the NAD, and then we need the activation. We need to move that cells. As you know, as maybe all of you know, when we talk about the degradation of the cells, we also lose the capability of the natural program death of the cells. So when we introduce the exosomes, we also can activate this natural degradation of the cells, and at the end, we can have this younger cell or younger tissue that is going to have a better response against external factors. So this is when we come back to the stressors or the promoters of the angiogenesis. And well, the other magnific longevity results that we have are the growth factors and the biomimetic peptides. These are also one of the ingredients that they are going to have an effect of the activity of the vascular endothelial growth factor. Here we are going to increase the production of the angiogenesis. We are going to increase the production of all our nourishing. But also here we have the internal and local activity of the growth factors. So it's not just the global effect that we are going to create in the activation of natural growth factors. It's the growth factors that we induce into the tissue. These growth factors that we induce increase the natural proliferation of the cells, the angiogenesis, and increase the collagen production, specifically of type 1 and type 3. So that's why it's really popular in this case, the growth factors. But maybe one of the most popular growth factor is going to be the tripeptide, the Cooper tripeptide, that is going to give us this more a stimulation of the collagen that is going to give us more support to the fibroblasts and making these pro-angiogenic factors to develop more this natural process of the longevity. We need to make this balance between what we are going to do with the treatments that activate, the treatments that they increase the energy in the cells, and the treatments that increase the collagen stimulation. As you can see, looks like everything is the same because everything is going to the same path of skin longevity, but it's not the final way, or it's not the pathway that we are going to do in the same way. That's why we need to combine the treatments to go with a better result. So, well, just another popular treatment that is aligned with the longevity treatment is the niacinamide that help us to this skin barrier. I don't want to go deeper in this because it's the time is short and I know you are busy. So what's going to happen here? This is a short briefing of how you can make different treatments now, of how we can focus and select our treatments for each patient or for each different treatments. If we are going to talk about polynucleotides and PDRN, we are going to talk about skin quality and texture, mainly of all texture that is dry skin, dull skin. That's the main target. Then, if we have the plant exosomes, the centella asiatica exosomes, this is more for rejuvenation, for recovery, for post-procedures that can let us have a better result. Then we have the growth factors, that this is more a good complementation for the anti-aging treatments that can going to help us to make a global effect and a good skin recovery. And then we have the NAD, the NAD, the coenzymes, the niacinamide, that they are going to help us to make this barrier or this energy of the cells to help us to improve a full treatment. So what's the final point of all these ingredients? It's to always know that we need to do this combination between treatments of anti-aging treatments and longevity treatments. If we are going to do a structural treatment with an hyaluronic acid filler, we need to make a collagen stimulation. Could be with a biostimulator or could be with a skin booster. But the point here is to always do it, because when we induce the hyaluronic filler, when we induce to the hyaluronic filler, we are also increasing the activity in that area, then an inflammatory activity that it's going to consume energy. So if we don't induce energy to that cell, to that tissue, the collagen production is going to decrease. So if we are going to treat with a hyaluronic filler, if we are going to do this with a biostimulator, we need to know that we are going to need energy. So try to make a combination of the treatments between hyaluronic fillers, between biostimulators, between also regenerative treatments, and all the treatments that can help us to make a global approach. No, so What's going to be the best ideal treatment for a hyaluronic filler? The best ideal treatment in this case is going to be the one that activates, no, like could be the exosomes, or like could be the PDRA, in this case with the ceuticals, the aureole, no. In this case, this is the one that is going to give us the elasticity that the skin needs to recover to the hyaluronic filler, and also to make a restoration of this volume. This is the moment when we can see the skin how gets brighter, because it's not about just how we hydrate with the hyaluronic filler. It's also about to give this skin quality and this skin volumination and natural in a natural way. If we are going to do a collagen biostimulator, we need to go in the same line with a natural treatment, with a nourishing treatment that can give us a restore of the deep architecture of the skin, like could be an elastin supplementer, in this case the firming regen, or like could be the mimetic peptides and the growth factors that they are going to help us directly to increase this collagen production. No, another option here could be also, for example, the NCT hyal that can help us to increase this response of energy in the tissue. What also we can see another treatment that is between this line of anti-aging and longevity are the EVDs, no, all the energy devices that we have in the market, or the energy devices that you use. And in these specifically treatments, the recommendation is recover, no? Which treatments recover? Exosomes, growth factors, and PDRN. No, these are the three that, if you remember, these three increase the angiogenesis production, the angiogenesis and the BGF, no, the vascular endothelial growth factor, and in this way is going to be the one that is going to help us to decrease the downtime and increase the response and the recovery in immediate effect. Remember that in this case, when we are going to use an EVD, we have less than 20 minutes to apply our treatment. Why? Because in this case, we have an active reaction that we need to measure and control with the treatment that we select in less than 20 minutes. The science says that if you make an approachment in these 20 minutes, you are going to have a best result and more effective result also in the recovery and the collagen production. So just a short briefing of how you can select and how you can make this table of recovery, and going back to the 6 pillars that we need to select. And this is we are going to change a little bit about how we can perform in the consult, and how we can perform in the treatments that we develop with our patient with our hands. We have the other factors that we need to impact now, because if you do your treatment and you perform any treatment, but you don't perform a full global protocol for the patient, whatever you do, you are going to do, that patient is not going to go, it's not going to have the best result. It has to be these 6 pillars align, these 6 pillars approachment, so you can have a global approachment of the inflammation, of the mitochondria, of the epigenetics, of all of the full pillars to help us to make a full improvement. So remember, first of all, nutrition, physical activity, stress management, that's covered by us, because we can say to the patient, don't work more, you need to stop the work. It's not that kind of stress that we are going to manage. We are going to do this management with the local stress factors of the cells, increase the sleep, increase the avoid of toxins, and recommending the natural social connections. Now, that's maybe one of the ones that we are not going to have a direct impact. But how we can do in nutrition, we have a specific elements or foods that they are going to help us to make these aligns to the longevity. Which are going to be these foods? Foods rich in polyphenols, carotenoids, omega-3, and fats, mono and polyunsaturated fats. Now, how we can introduce? Just be sure that when you are in your consult, ask to the patient directly if they are eating one of these four ingredients. No, berries, if they are eating tomatoes, if they are eating fish, if they are eating nuts or of olive oil. If they are not eating, try to make a short mention of this. If you make a short mention, the patient is going to know it. Sometimes we think that as we know it, we don't need to make this mention to the patient. So try to mention to the patient, try to mention a little bit about if they are eating one of these ingredients, and that's enough to make a short approach of the nutrition. Now, as you already know, if we have sugar, we are going to have this impact in the collagen. So this collagen impact is going to make the degradation and the degradation of the glycemic of all the glycemic effects or impact in the tissue. So we can make a short briefing or a short mention of decrease the sugar. Your treatment is going to be so much better if you decrease. But if you said that the patient needs to avoid something, it's not going to give you the best result. Now, it's going to be short for the patient. The best way to do it is introduce it with a different way to mention it. No, like, okay, if we are going to treat, if you are going to eat something, if you want to dip something, if you want to eat something in between foods, you can eat berries. No, and you can increase the food or eat something like olives. No, and in this way we are going to introduce to the Mediterranean diet without talk a diet, without make a specific diet introduction. No, it's just to let know them that you have this possibility. And the other possibility is make the introduction of collagen supplementations. No, as we already know, a natural diet, doesn't matter who you are, is not enough in collagen and proteins. So if you introduce a collagen formulation, you can also make different approachment and make full sure that your treatment is going to be quite effective. And of course, in the case of all the habits, try to avoid and remember in all your consults, try to avoid the sun, try to avoid tobacco, and if you are going to be exposed to the sun, try to make always a fix an application of every 2 hours of your sunscreen. Doesn't matter if it's the summer, doesn't matter if it's the winter, every 2 hours we need to apply our sunscreen to be more effective. Well, sleep and exercise, keeping the balance, just to mention it, be sure that your patient is doing it because this has a really high impact directly in the skin quality. So by this way, you are going to have a full protocol of lifestyle in these phases and make it a full treatment for your patient. As we said it, and we said longevity treatments is a different treatment. It's really hard to make full consult for your patient that can keep between the balance of an visual effect and a satisfaction, an immediate satisfaction of the patient. So try to be really clear in the first moment of that consult. If you are going to have a treatment of 12 weeks, be really clear. Don't try to say, okay, in the first session you are going to see change in results. Maybe they are going to see it, but not all the patients respond in the same way. No, so try to make it with evidence. Try to make it in the consent form that they are sure that they are going to wait until a full protocol so to stay and see results. Try to be clear with expectations. If the patients need a longevity treatment or the patients need an anti-aging treatment, it's going to be different, no? And always remember, make this follow-up. If you don't have the possibility of detect methylations in DNA, if you don't have the possibility to detect ages in the collagen, in the skin, in the blood, try to make it by another pathway, because longevity treatments are in trend. We need to introduce our treatments in the longevity in our catalog, but we also need to give the proper follow-up. It's not the natural follow-up of a natural treatment, it's a different follow-up. So we need to make a molecular or a cellular follow-up to be sure the patient is going to be satisfied. And well, try to make your treatment safety. If you are going to be drug delivery, avoid the compromised skin, avoid to make an exacerbation, or avoid to try to say that you are going to have an immediate result, because the patient is going to be mad in one point if they think it's going to be fast result. Remember, the patient, they always are going to be trusting you. You sometimes think, okay, if I'm not sure, if I'm not clear with the patient, if I don't say to them that they are going to need more than one session, they will not come back. But the patient is going to be open to your ears. It's going to be open to your words, and they are going to hear you. So if you are really transparent of how it's going to take this time, how it's going to be the result, how it's going to be in the next years, these results, the patient is going to be so much satisfied than in other cases. And well, just going back to the mesotherapy and the topic of ceuticals, just so you can be sure of this natural decision algorithm. If you are going to talk about skin quality, try to make a treatment with polynucleotides, exosomes, and use microneedling. If you are going to make a treatment of loss of volume or dull skin, if you are going to combine it with a filler, try to make it with Aurelum, that is a PDRN. Try to do it with a regenerative treatment that induce the energy, like could be the NCT high, like could be mimetic peptides. If we are going to have a sagging skin, try to do a treatment with the Firmin Regen, with the company of a Firmin stimulator, that they are going to be sure that it's not going to be just the collagen production, also the elastin support. And if you are going to have a photo damage, try to make it with a full treatment of combined between an EVD and a regenerative treatment. And in all the cases, all the patients try to make this lifestyle that we talked today, so they can be more satisfied with everything and not just with the treatment that you are going to give it in that moment. No, you are going to give it a global approachment. And well, just for know how we are going to do a sequence, try to make protocols between 12 weeks to 24 weeks and make different approachments in these cases with these different regeneration treatments. Now, in these cases, I'm going to go because the time is short. In these cases, if you are going to make a treatment with a biostimulator, if you are going to make a treatment with any other treatment, you can make treatments of nourishing a bit in the phase zero, no, to make an induction of the activity of the energy. The best, maybe one of the two best products to begin or to prepare the skin is going to be the NCT high, that is going to give you energy, and then you can go with an exosomes to also make an activation. No, you can go in the same session, and you're going to be sure that you are going to have energy and activation. Then you can perform your treatment. If you are going to do a treatment with an anti-aging effect, you can perform it in that part, or you can start with a phase of regeneration treatment with a more specific treatment for that patient, no? And always keep the phase of the home care, so you are going to be sure that this treatment is going to be going by itself. And well, I think like in the career and in all the times, this is the favorite part, is when we see how we make it practical, all the theoretical way, no? So imagine you have a patient of 48 years and with a sun damaged skin, and you have a generalized loss of firmness, no? A dull tone, and is not has any pathology or any inflammatory disease, and you want to perform a full protocol of 6 months plan. No, this is going to be a full protocol, not the 6 month in the consult. It's a 6 months plan that we are going to give to the patient, so they are going to be sure that what they are going to come today, it's going to be 6 months plans. It's not just the today consult. It's not today. The today visit is about a 6 month plan. No, and the goal in this patient is going to be improve the skin quality and improve the firmness and having a natural result. In these cases, as we have a dull tone, as we have sun damage, we need to recover the skin. We can perform an NCT high session with a depth of 0.5. We can increase, we can make a treatment of anti-aging treatment, and we can do a treatment of regeneration. In this case, the regeneration treatment needs to go deeper. As you can see, microneedling, it's has the best results that we can find in the microneedling is between the 1.5 until the 0.5 minimum. So if we want to do a treatment that gives us a really good result, the best way is to do it between these lapses. In short treatments that we need to treat the epidermis, go between 0.5 to 1 millimeter of depth. And if we are going to make a regeneration treatment, we need minimum 1.0 between 1.5. No, that's the best way. Sometimes we are scared about 1.0 because we said this is really deep. This is really deep, but 1.0 is the best way to treat it. Obviously, in some cases, like phototypes 4, 5, and 6, we can decrease it a little bit until 0.75 or 0.5. But the ideal way to have a good result with regenerative treatments is going to be 1.0. And at home care, try to make always a regenerative treatment with the stem cells, with exosomes, with polynucleotides in cream. Now, as we can have it in the extreme, the skin renewal, or as we can have it also in the sunscreen of ceuticals that contains zinc oxide and help us to the recovery. Now, and remember that we are going to plan this lifestyle totally in this 6 months plan. And how we can alternate between sessions. We need to evaluate. Now, if we are going to perform a specific treatment in mesotherapy, we need minimum 15 days. But if it's going to be a regenerative treatment, we need minimum 21 days, every 3 weeks. No, more or less, we recommend to the patient every month. No, so in that case, we are going to have this full protocol. Here we have another example. This is a younger patient, 34 years old, dehydration, early fine lines, a loss of glow, associated also to this loss of energy in the early 30s. She doesn't want any injectables. She hates injectables, and she has an event in 3 weeks, so need to do something faster. No, we have a lot of patients that they never do something. They hate to do something all the time, but when they have an event, they want to do something. So the best option in these cases is to do something with succinic acid, like will be the GABA. And also here we can treat the early fine lines. So it's going to give us a really effective treatment with the GABA. Another option with patients that they don't like injectables, they don't like microneedling, we can use it occlusive treatments. How we can do occlusive treatments? We can make a deep exfoliation and a deep soft damage of the epidermis, and then apply like a mask, our mesotherapy, and then with gas we can cover the face and let this hydration for 20 minutes. This is an ideal treatment for patients that they hate really too much the needles, even the microneedling. In this case, if we cover and with an occlusive, and we can apply light devices, maybe a red light, we can increase the absorption and we have a really close effect like microneedling. In this case, we can make a combination in the 6 sessions as we have just 3 weeks to perform the treatment. We can make the high effect or the regenerative treatment in the first session that is going to give us the GABA, and then we can perform the nourishing effect that is going to give us this immediate glow, like will be the NCT Hyal one day before. This is the one that contains the NAD, so the energy and the revitalization is going to be faster. No, so in 1 week before the treatment, we can go with an NCT Hyal. If the patient wants microneedling in a softer way, we can go it and apply it in a bag in this same session. And well, this is another example, 52 years old patient, thinning lips. Maybe this patient is more for an anti-aging treatment, but we can also perform a treatment for a recovery, for a recovery of this quality of the lips. So in this patient, we also want to do, she's recovering of a fractional laser, so we want to recover and accelerate our treatment. This patient, we can treat it in a full face if we want to treat these thinning lips and we want to recover from the fractional laser with a PDRN formulation. The Auriolum is going to be the best option in this case. That is going to help us to make this permeability window, that is going to help us to recover totally this skin and also to increase this blood flow, because at 52 years old, we also have a disruption of the blood flow in the tissue. So, as you can see, in the longevity treatments, we have to treat with formulas. We need to treat with innate ingredients. We need to choose our treatment more basically in the formulation. Maybe in aesthetic medicine, we sometimes forget what we do in general medicine or what we do in other lines of medicine. In other lines of medicine, we treat with the main ingredient. So we need to go back in that point and remember that we are treating with the main ingredient. We are going to make an impact with the main ingredient. The formulations they can give us the easy way to select us now, because the laboratory designed the formulas to make a focus just in that main ingredient, but just to make an approachment of something aligned. But if you focus and you remember always the main ingredient and what it's going to do in the longevity role, it's going to be easy to choose the formulation that we want to do, or the formulation that we want to make an approachment. So if we want to make this role, for example, as we already said it, if we want to do tissue regeneration and we know that we need to repair the tissue, we need to increase the blood flow, we are going to think about PDRN, and automatically I'm going to think, okay, PDRN is presently in Auriolum, so I can choose it. And I don't need to to think about, okay, Aurelium is just a product for this and this and this and this. I can make a performance and a treatment more dynamic, and that's the intention of MD Ceuticals. Try to make it more dynamic for you. Try to make more science. Try to make it more medical grade to these treatments, because we deserve it. Aesthetic medicine deserves to make a medical grade always. So we need to keep it in that role and go with the active formulas to the active ingredients. No? And well, so we have the growth factors, proliferation and repair signals, the biomimetic peptides that they're going to help us to in a specific path of signals in the cells, NAD for the energy, niacinamide for the barrier, the coenzyme that we have in the extreme also is a regenerative and longevity treatment, and try to work with this now that can help us to make an improvement. And well, this is just so you can know, for the people that doesn't know about the brand. This is just a short briefing of what you can find in the brand. Talking about the exosomes, if you want to treat with exosomes, we have a product of exosomes with polynucleotides that has this combination of activation and tools for recovery the skin and make a regeneration treatment. We have the mimetic peptides and the growth factors that they have the NAD, that we have coenzymes, we have all this activation that we need, but also all these growth factors that they are going to help us to make the recovery and the regeneration in the tissue. And well, the Aurelium, that is PDRN specifically, not polynucleotides, it's a PDRN that can help us in older patients to also make a recovery of the volume and a pumping effect that we wanted, and the firming region that is going to help us to increase the elastin in the patients with collagen and the elastin. So this is the end. Thank you so much. We are going to pass to the questions, but before the questions, I just want to make this a short keys to take away to your next day in your consult. Remember that in 2026 we are taking more the longevity path. The longevity path began in the 2024, and we are still going in that path. So for the future, until the 2030, what the progression thinks is that more longevity treatments are going to be developed, and it are going to be longevity treatments in the market. The biological skin age, it has to be measured in the longevity treatments, because as we have the photos and we can see dramatically, what we are going to do in longevity treatments is make a slow down with the aging process, making more natural, and this sometimes for the patients can make an impact, and they think that as they can see dramatically in a photo, maybe they are not having results. This is more, longevity is more in a molecular and cellular way. We need to make an intervention, but evidence. Maybe polynucleotides and PDRN are the more effective and has more in evidence, but also growth factors has evidence for these longevity treatments. And also technologies like exosomes are having more and more research that in the future we will see that maybe could keep this evidence as the same path like polynucleotides. Combining, it's the option. I didn't say it, but in one of the papers that you can read after, what we are seeing is that the monotherapy by itself is not enough to give a longevity full treatment. So doesn't matter if you are going to do an anti-aging treatment or a biostimulator treatment or a laser treatment or a regenerative treatment. What you need to do is make combination between this and also the lifestyle that can help you to make this combination of treatments. If you don't have maybe the possibility, because of your practice, because if your consult is like this, to do a little bit of everything, try to make the combination between regenerative treatments, longevity treatments, and the lifestyle. If you make this induction of diet, of lifestyle, um, of different things for home care, of different paths to approach in the home, you can make this effect, and it's considered like not to do a monotherapy. And well, lifestyle, remember these 6 pillars. We can impact in these 6 pillars and make a more longevity and full protocols. And always ethics first, try to make more these clearly treatments for the patients, that this is not a radical change like could be in an older days with fillers. This is more natural. This is going to be to make slow down the process, and also to make an increase of the natural energy cells, so we can be sure that we are going to have a good activity in the cells. So, well, let's talk a little bit about the questions. I think we have some questions. It was it was 1 hour. It was a lot of time. What was really fast. Well, first question, Tammy Martin says, how comparable are your plant-based exosomes to human-derived exosomes in terms of efficiency in the skin? Okay, well, the discussion between plant-based exosomes and the human-derived is really huge. Human-derived exosomes, they have a high content of protein in these exosomes. So when we talk about this human-derived, we have the risk of a high reaction. The plant-derived, specifically the hours that they contain Centella asiatica, and that they are from Centella asiatica exosomes, they have more increase in microRNA. That is not a full chain of protein, and it's more compatible with the skin cells and all the tissue cells. No, so we are going to have this less risk of reactions that we have in the human derived, and also as we have microRNA in these exosomes, you have more control in inflammation process. So you have these both ways to make the activation and also to control the inflammation process that can help us to make a more global treatment. Well, I think the discussion between human and plant-derived is really clear. Maybe depend of some countries can cause more doubts, but what the science and in the global worldwide is saying is that the safety profile is plant-derived, and also is the most effective in terms of inflammation. Well, let's see if we have another question in here. Okay. Well, I think we have just one question. Oh, let me come back here. I don't know how to come back. How to treat melasma using exosomes, and which one of more effective melanocyticals with exosomes? Okay, in the case of melasma, remember that melasma is an inflammatory condition. So when we try to make an approachment with exosomes, we are in the right way. But what happened with melasma? If you just treat it with exosomes, you are going to be really short with the treatment. Exosomes are like a little bit of everything. It's not a specific treatment for that all the paths of the melasma. So if you are going to treat with exosomes, the recommendation will be to activate with the exosomes and regulate the inflammation, and then you can treat with a specific treatment like will be the melanocyticals. No, so you can go doing your specifically treatment of the exosomes today, and after 2 days that we are going to be sure the inflammation is controlled, that we make the activation of the exosomes, you can go with the melanocyticals. Sometimes some doctors do in the same moment both treatments. It's possible, yes, but what happened? Melanocyticals is an uncomfortable treatment, so we recommend sometimes to do it just by itself, so the patient can be more controlled, and also the patient is more calm with the treatment. And in this case, also we can identify if there is one reaction to one of the or another. No, maybe you can just do it in the first session, independent exosomes and then melanocyticals, and then that you have this impregnation, then you can do it in the same session. Always try to do it in different depths, no, or in different techniques, so that that's another way that you can make both treatments in the same session. What we never recommend, and it's an indication of the laboratory directly, is to never combine in the same syringe. What happens if you combine it in the same syringe is that you don't have the time control of the how much time is going to pass in the syringe, both vials or both contents interacting. And the problem in that case is that you can affect the stability of both ingredients. So to not affect is not that you are going to create any risk or any reaction, but you can affect the stability of both ingredients, and you can break one of the ingredients. So to not break it, the recommendation is always, if you are going to combine it in the skin, never in a syringe. Next question. Are you suggesting combination with Cooperov too? Yes. Combination with Cooperov in the cases of patients with rosacea, specifically if you treated exosomes with Cooperov, help you to control all the natural inflammation of the rosacea, and also all the natural path of the Cooperov of the Cooperosis with the Cooperov. No, so in these cases, what it's going to be recommended is always with exosomes start with a short dose. Why? Exosomes also increase the vascular endothelial growth factor in a less effect than the polynucleotides, but they can increase also the angiogenesis. So as we want to control that part also, the recommendation is to not use more than 1 cc, 1 milliliter, in the case of the exosomes for the patients with rosacea. Not if you are going to combine it. If you are going to do a specific treatment just with exosomes, you can arrive or until the 2 cc's in a full treatment for rosacea. No, and you can also do it in the same way like melanocyticals and exosomes. Always in the skin, combine it directly in the skin. Try to not combine it in the syringe. That's the most important point. So you are going to be sure that the exosome the membrane of the exosome is going to be completely arriving and at the cells. Let's see, we have another question. Let me see. Well, I think we are over. Thank you so much to everybody. Thank you for joining us. As part of this webinar, you are going to receive an ebook in the next 3 days. In this ebook, you are going to find all the bibliography that it's comprehensive of this, and also you are going to receive some insights more described of the protocol. This was a really scientific presentation, but we want to do more practical presentations in the future. So we recommend you to follow the YouTube of MD Ceuticals and also the Instagram page. Also, there you can find my Instagram page, and we are going to go. We are going to publish the next webinars that maybe will be more practical, and different webinars of different types with all the anti-ceuticals protocols. And that's it. We have another question here. With GABA, can GABA be combined with mimetic peptides and can GABA be combined with biomimetic peptides? Yes. Okay. What happened with GABA and biomimetic peptides, it's that maybe you are talking a little bit of the same. So if you want to treat like biomimetic peptides to induce to the angiogenesis, you can put it before the GABA, and after that you can put the GABA. But if you put it in the same moment at the same time, remember that in the mimetic peptides you have the peptides that they are going to help you to increase the regeneration. You have mimetic peptides to increase the hydration and also to relax the skin tissue. So if you combine it in the same moment, maybe it's not going to be it's going to give you a little bit more effect, but it's not going to be give you a radical effect, no, because you are treating in the same line. If you are going to do it to increase the angiogenesis, to increase the blood flow, you can do it before. And another question: if the patient has oily skin, large pores, dull skin, and oxygenation, which treatment is ideal? I will go with the Cooperov that contains a high dose of niacinamide. But if we talk in this case of the treatments of longevity treatments, of regenerative treatments, will be the exosomes and polynucleotides. What is going to help you is the polynucleotides of the exosomes are going to increase the oxygenation. The oily skin is going to be controlled because you are going to be controlling the inflammation that could be creating that oily skin or that damage in the barrier, and you are going to make a regulation of the environment in the skin. Now, so you can combine it also Cooperov and exosomes. And another option, maybe if you have more dull skin and you want to make like more revitalization, could be the NCT higher. This could be a really good option, but if you have more component of this dull skin. But if you have large pores, the best option will be always the Cooperov. The Cooperov has a good content of niacinamide that will help you to restore the texture, restore the large pores, and also helps to regulate the oily in the skin. Let's see if we have another. After botulinum toxin, can I have a treatment with GABA? Yes. Okay, here is an important point. If you apply, in the case of botulinum toxin, if you apply treatments immediately before the 2 weeks of high effect of botulinum toxin, you can increase the absorption of the botulinum toxin. And that's not said by us, it's said by laboratory and by some papers. But what is totally true is that if you perform a treatment of GABA after botulinum toxin past the 3 months of the botulinum toxin, you can increase the effect of botulinum toxin. Now, because in this case, we are going to make an approachment of the curve of the acetylcholine, and in that case, you are going to make a recovery or reappointment of that botulinum toxin in the last months. The recommendation, making the balance between botulinum toxin and the GABA, it's 4 months. At the 4 month of the botulinum toxin, make another treatment with GABA. And other way could be before. No, as the GABA is going to help you not just in the natural movement of the muscles, you are going to make an approachment of the GABA receptors in the skin. The relaxation is going to be in the surface. So, but that way also you can make a softer booster of the botulinum toxin in the future. No, but that will be if you apply the GABA before to not affect the effect of the botulinum toxin, obviously. And well, that's it. Now we are over with this webinar. Thank you so much for joining us. Hope to see you in future webinars. Hope to see you in the next webinar that is going to be more practical. And well, don't forget to follow us. And thank you so much for joining us. Hope you enjoyed. And nice to meet you. And bye-bye.